हेलो फ्रेंड्स, आज की इस वीडियो में हम डिस्कस करेंगे ब्लड ग्लूकोज हेमोस्टेसिस के बारे में। हाउ द ब्लड शुगर ऑफ आवर बॉडी रेगुलेट्स और मेंटेन्स बाय द हार्मोन्स और डिफरेंट प्रोसेस। हेडलाइंस: व्हाट्स द ब्लड ग्लूकोज हेमोस्टेसिस एंड हाउ ग्लूकोज maintained in our body, different hormonal factors and renal mechanisms. Blood glucose homeostasis means the balance between insulin and glucagon that maintain the blood glucose level. The regulation of glucose is important because it is essential to help the continuous supply glucose to the brain and other organs. That means glucose is very necessary for the various works day-to-day life. When you take the food, it convert to disaccharide means lactose, maltose, and sucrose. Lactose composed of two types of sugar, that is glucose and galactose. Maltose is glucose, and sucrose is glucose and fructose. Then factors affecting blood glucose regulation. Three factors. One is hormones, then metabolic process, then renal mechanism. In case of hormones, these are divided to two types. First is hypoglycemic hormone and second is hyperglycemic hormones. Hypoglycemic hormones means the hormone that reduces the blood glucose is called hypoglycemic hormone. Example is insulin. Insulin secretes from the beta cell of the pancreas. Then the hyperglycemic hormone. These hormones increase the blood glucose level. Examples are epinephrine, thyroxine, growth hormone, ACTH, adrenocorticotropic hormone, cortisol. Here is the hypoglycemic hormone and here is the hyperglycemic hormone. Let's understand how they regulate the blood glucose level. In case of high glucose level in body, that signals to release the hypoglycemic hormone means insulin that reduces the glucose level in our body. In case of low glucose level, body signals to release the hyperglycemic hormones, that means glucagon, for increase the glucose level in our body. Here is the balance between the glucose level by the hormones in our body. Three types of regulations in case of fasting stage. First is glycogenolysis, means breakdown of glycogen and convert to glucose and release to the blood. And then gluconeogenesis, that means synthesis of carbohydrate from non-carbohydrate. Lactate, glycerol, gluconic amino acid. Lipolysis means lipid and triglyceride breakdown and convert to the glycerol and fatty acid. Then glucose regulation at the postprandial stage. Here is the after taking sufficient or required food meal. There are three types of glucose regulation. First is glycolysis, means breakdown of glucose and go to our blood. Then glycogenolysis means excess amount of carbohydrate that convert to glycogen. Then third is lipogenesis, means extra glucose convert to lipid and store in our body. Then renal mechanism. Normally glucose is not excreted through the urine if blood glucose is level more than 180 mg per dl. Then the complete tubular reabsorption of glucose does not occur. So the extra amount of glucose excreted through the urine that causing glycosuria. That means glucose in urine. Generally, glucose is detected by the Benedict's test. Renal threshold: the blood glucose level at which the glucose excreted through the urine is called renal threshold. Its normal range is 180 mg per dl. Blood glucose level is increased from 180 mg per dl, then the glucose excreted through the urine. Test regarding blood glucose estimation. At first, the collection blood is collected in the sodium chloride anticoagulant vial that inhibits the glycolysis. by inhibiting the enzyme enolase. That means the breakdown of glucose stops due to the anticoagulant, sodium fluoride. At first, the Benedict test it's not a quantitative method. Here is we detect only the presence of glucose in the sample. For the detection of the glucose in urine, also use this method. Here is a only qualitative method. Means glucose present or absent, but the amount of glucose not measured in this method. Then enzymatic method, it is COD-POD, glucose oxidase peroxidase method, is the most specific gives true value of the glucose. In this method is used in autoanalyzer glucose in the presence of glucose oxidase enzyme converts to the glucuronic acid and hydrogen peroxide H2O2. Then the hydrogen peroxide in the presence of peroxidase enzyme convert to water and nascent oxygen. This nascent oxygen gives oxidized to the this nascent oxygen oxidized to give the color to the solution. This color is measured by the colorimeter. It's the process of enzymatic glucose detection or glucose estimation by GOD-POD method. Then other tests regarding glucose estimation. Enzymatic methods are glucose oxidase peroxidase method, hexokinase method, then glucose 6-phosphate dehydrogenase method. Three types. Then non-enzymatic methods are orthotoluene method, Nelson smuggling method, and Follion E method. Then diabetes mellitus. Diabetes mellitus is a metabolic disease due to the absolute of insulin deficiency. Insulin deficiency leads to increase the blood glucose level. Due to high blood sugar, the normal urine also contains sugar. It's the metabolic disease. It's three types: pre-diabetes, type 1 diabetes, and type 2 diabetes. Pre-diabetes, when blood sugar level at the borderline, that means higher than the normal range but lower than the diabetes. Pre-diabetes may or not progress to the diabetes. Here fasting is 110 to 126 mg per dl. Then type 1 diabetes mellitus. It's known as the insulin dependent diabetes mellitus. In this case, body does not produce insulin or insulin level is deficient. It cannot be prevented or cured. Normally managed with the insulin injections. These patients are more prone to develop ketosis, means the ketone body formation in our body. Symptoms are frequent urination, thirst, fatigue. These are two types: immunomediated and idiopathic. Then type 2 diabetes mellitus. It's known as insulin independent diabetes mellitus. In this case, body makes the insulin but unable to use due to the insulin resistance in the cells. In this case, it can be prevented through the lifestyle modifications. These patients are less prone to develop ketosis. Symptoms are poor lifestyle, blurred vision. It's three types: obese, non-obese, and maturity onset diabetes young. Lab investigations for the diabetes mellitus: plasma blood glucose level, then complete lipid profile test. There are 5 tests under the lipid profile: cholesterol, triglyceride, HDL, LDL, VLDL. Then kidney function test, means urea creatinine, then microalbuminuria, then glycosylated hemoglobin or HbA1c. Glycosylated hemoglobin or HbA1c. Hemoglobin A1c test is a blood test that shows your average blood sugar level over the past 2 to 3 months. When glucose is attached to the hemoglobin, it means its lifespan of RBC. That means glucose attached to the RBC surface. Generally, we know that the RBC's lifespan is 120 days. That means that glucose particle is on the RBC surface up to the lifespan of RBC. That means 120 days. So these are hemoglobin that together is called HbA1c fraction. The normal range is less than 5.7. Then in case of pre-diabetic case 5.7 to 6.4%. Then in case of diabetic patient above 6.5. Thanks for watching. Please like, share and subscribe. Press the bell icon for the latest updates. Again, thanks for watching.